Hello, everyone. A very warm welcome to the Safeguarding Resource and Support Hub Nigeria webinar on donors and funders' roles in promoting safeguarding implementation amongst organizations in Nigeria. I am Dr. Eleanor Wadinobi, the Senior Advisor and National Sustainability Lead for the Safeguarding Resource and Support Hub, RSH Nigeria. I am also wearing another hat as the President of the Medical Women's International Association. Please note that you are all on mute with your videos turned off. This is to support with the quality and connection of the webinar. Please be aware that we will be recording this webinar to share on the online hub afterwards for anyone who was not able to join. And please be reassured that your names will not be visible. Our webinar today will be looking at the importance of donors and funders' roles in improving the effectiveness of safeguarding culture amongst organizations, specifically in Nigeria. We also aim to create further awareness for other donors and funders to come on board in promoting safeguarding implementation in their partnerships with organizations in Nigeria. In order to do this, we have invited two speakers who will give us practical insights, and they will talk us through each of the key aspects of this webinar. Let me introduce our first speaker, Mr. David Ukagu, who heads the subnational team of the Foreign, Commonwealth and Development Office, otherwise known as FCDO, Nigeria. He's a member of the senior leadership team and oversees the strategic leadership and delivery of the subnational team's work across Kano, Kaduna, Jigawa, and Enugu, interfacing with key state and non-state actors. He's a human resource management generalist, experienced in strategic management, planning, and administration, and a development program and project management specialist with international development organizations and multinationals. David holds an MBA from SUD Business School, a postgraduate certificate in business administration from the University of Leicester, UK, as well as a certificate in project leadership programs from the University of Cranfield in the UK. David is a fellow of the Chartered Institute of Personnel Management, a governing council member, and chairs the Professional Development and Learning Committee of the Institute. He has served the Abuja branch in various capacities as Assistant Secretary, Secretary, and Vice Chairman. David is the SEAH, that is the Safeguarding Against Sexual Exploitation, Abuse, and Harassment Network Lead for FCDO Nigeria, and he works with a team of 19 safeguarding champions across the organization to create awareness, understanding, and ownership commitment by all in the organization to their safeguarding responsibility. Now, David's presentation will focus on FCDO's perspectives and commitment to safeguarding. It'll highlight the importance and benefits of safeguarding in FCDO's work with partners, FCDO's safeguarding PSEA-H expectations from prospective partners, FCDO's commitment towards promoting safeguarding in their work with partners, and will tell us why it is important for other donors and funders to promote and support safeguarding amongst the organizations that they work with. Now, our second speaker is Diba Abu-Nijila. Diba is the Protection from Sexual Exploitation and Abuse Interagency Coordinator in Nigeria. Diba has more than 13 years of experience in PSEA and sexual and gender-based violence programming in complex and highly volatile environments, including extensive experience in working during emergencies, in early recovery, and during cessation of hostilities. Diba is an accomplished trainer in PSEA, humanitarian principles, and protection. Her previous work includes roles with UNICEF and UNRWA and has a background in academic research and local government planning in Arizona in the United States of America. Diba holds a master's degree in public administration from the University of Arizona. Her presentation will focus on the role of the PSEA network in promoting safeguarding and PSEA amongst organizations. Dear participants, now that you have had the preview of our distinguished speakers for the webinar, let me give you a few housekeeping details which we'd like you to keep in mind, please. Kindly be informed that we have available closed captioning. You can access the closed caption feature by clicking on the CC button at the bottom of your screen. Please be advised that this webinar does contain content on safeguarding and some may find distressing. If you would like to ask any questions during the live Q&A session, please add them to the Q&A function throughout the webinar. And you can find the Q&A function in the controls panel at the bottom of your screen. You can add new questions to upvote any existing questions. And what we will try to do is to cluster them in order to answer as many of them as possible. So with the housekeeping out of the way, it gives me great delight to call on our first speaker, David Ukagu.
Thank you very much, Dr. Eleanor. I'm grateful to have this opportunity to be here to share some thoughts with participants on this webinar. Are you projecting the presentation or do I do so?
Please do go ahead and project them kindly.
Okay, a few seconds.
And whilst David is getting his slides up, I see that some of our esteemed participants are already introducing themselves in the chat. So please do go ahead and introduce yourselves in the chat.
Sorry, will soon be up there. Apologies, trying to get through this technology. Really sorry. This hiccup here.
Don't worry about it.
Well, seems to be struggling with putting up the presentation, but happy to talk on about it if that's okay with you.
Yes, please do go ahead.
Okay. Once again, thank you for this opportunity. From FCDO's end, the importance of safeguarding and the issues relating to protection of people against sexual exploitation, abuse, and harassment is something very, very important to us as an organization. SEER for me has become a growing pandemic that we really need to be mindful about and do everything possible to safeguard people from the scourge of abuse, sexual exploitation, abuse, and harassment. If we go back way to the early findings in 2020, there was reports that 387 allegations of sexual exploitation, abuse, and harassment occurred amongst UN peacekeepers and civilian staff who were in one form or the other supposed to be supporting beneficiaries. The other challenge also is that data on sexual exploitation, abuse, and harassment in the AIDS sector is very, very limited. And as such, it's always difficult to have all the relevant information of what is happening in that sector as regards SEER issues. And so it becomes necessary that these awareness, for which Resource Support Hub is also helping to create, becomes very important to help stem that tide. 1 in 4 women workers in the AIDS sector are also reported to be assaulted in the course of their work in the AIDS sector. So even amongst us in FCDO, we constantly review our activities to also gauge the status of sexual exploitation, abuse, and harassment within the organization. A study we did last year indicated that we still had about 23% of female and 6% of male who reported experiences of SEER over the past year, that is looking at 2022. And so this becomes important that we continue to look at these issues and do our best to guard against the challenges that arise from SEER. Sexual exploitation, abuse, and sexual harassment for us continues to be a very significant risk area that requires our attention, and also important for not just FCDO, but also partners that work with FCDO to pay attention to. The need to step up measures around preventing and also responding to issues of sexual exploitation, abuse, and harassment in organizations and in partner organizations becomes very, very important. So for us in FCDO, the risk management policy we have put in place raises the issue for us and helps us focus on dealing with this matter, because for us, safeguarding risk has to do with risk arising from failures to establish and maintain strong safeguards that prevents harm to beneficiaries of our programs, staff, and those implementing FCDO programs, the communities where our programs work, as well as the environment, which results in ethical violation and reputational damage. And so for us as an organization, it's important that we listen to people in terms of what is happening to them. We respond to them, having heard them, and also learn from the reports that they have given around issues of SEER that has occurred or affected them. Our goal as an organization is to improve safeguarding against SEER standards across the aid sector, holding ourselves to the highest possible standards and also holding our partners to the same level of standards so that we can jointly work together to safeguard people against sexual exploitation, abuse, and sexual harassment. So for us, the importance of SEER highlights the fact that we have a zero tolerance to the issues of sexual exploitation, sexual abuse, and sexual harassment. And this zero tolerance is not just on the broader theme, but go to the details of the not taking action. So we have a zero tolerance also around not taking actions when SEER occurs. So we expect our partners, just as we ourselves will do, to do all that they can to ensure that they prevent and also respond to issues of sexual exploitation, abuse, and harassment as and when they occur in their organizations or in the environments where they work. So for FCDO, we have core objectives and also policies that also helps us keep ourselves, our program partners, and our downstream safe by the policies we put in place and the objectives that we work to deliver. Part of those objectives, four principally, one is around ensuring support for survivors. It's important that survivors are protected from further assault, and victims and whistleblowers are also adequately protected and safeguarded such that they can also boldly come out to report these incidences as and when they occur. Secondly, we try to incentivize a culture change through strong leadership, working with other organizations in the aid sector, working internally, working with our program implementing partners to ensure that there is incentive to develop that culture that has that strong zero tolerance against issues of SEER. We adopt the global standards and ensure that they are met and exceeded, and part of it leads us to working on what's a recent development which is called CAPSEER, that is common approaches to protection against SEER, which we'll talk about as we go ahead. We also strive to strengthen organizations' capacity and their capability across the international aid sector to meet these standards, which the CAPSEER enunciates very, very clearly. So for partners who desire to work with us, it is important that they comply with those objectives, those four key objectives that I've highlighted, as well as adhere to our policies around issues of safeguarding. Some of these policies, one can be mentioned, is around sexual activities with children. Persons under the age of 18 is prohibited regardless of age of majority and the age of consent in that locality. So we take a zero tolerance there as well. You must not exchange money or employment or goods or services for sex or for engage sex workers in order to in the course of your delivery of our FCDO programs. Sexual relationships between anyone who works within FCDO or beneficiaries of our program, we also scrutinize very, very closely, because we do not want situations where people are taken advantage of or exploited on the premise that you want to give them employment. So it's looking at the challenges around power imbalances and ensuring that people are protected in the course of working with us and working with our downstream partners and working with the environment and making it safe. To do this further, FCDO has what we call our due diligence assessment, the DDA, where certain standards are expected of partners who want to work with us. And this is all around safeguarding against SEER in the due diligence process, where we look at the organization and look at what the approaches they have to managing SEER. We look at what governance structures they have put in place. We also look at their recruitment and training processes, as well as risk management and how they are making effort to mitigate the challenges around sexual exploitation, abuse, and harassment, as well as developing a code of conduct. All these 6 core areas, FCDO has policies entrenched in them as well. And so we expect that partners who work with us will go through these items one after the other and help structure out their own organization in such a way that they are ready and willing to comply with policies, processes, and procedures around safeguarding those who work with them and those they work to, as well as the environment where they work. So the SEER approach in the organization, their complaints around whistleblowing, as well as risk management, how they deal with risk issues, how they deal with codes of conduct, and also governance practices. All these help us to support programs that work with us, and we are ready also to support them through our due diligence hub to get themselves in good order to be able to deliver services for us. So there is that urgent need to promote protection against sexual exploitation, sexual abuse, and sexual harassment. This is important because safeguarding is everyone's business. So for us in FCDO, every staff from the top to the least, it's all our business to pay attention to what is happening around safeguarding. Within my organization, like Dr. Eleanor mentioned, we have safeguarding champions across different blocks and teams that we work together to keep an eye on how the organization is doing around issues of SEER, and that staff are also following through with the codes of conduct, and the same thing with our program implementing partners. So FCDO has been working with UN and other agencies to promote the common approach to protection from sexual exploitation, sexual abuse, and sexual harassment. And this common approach has 6 principles and also 6 minimum action areas that everyone who works for FCDO will want to encourage that they also abide by and follow through. This helps in following through with the CAPSEA approach. It helps ensure that people are safe from sexual exploitation, abuse, and harassment. And it also helps prevent the occurrence or limit it as much as possible, and also enables us to respond properly and appropriately to challenges around sexual exploitation, abuse, and harassment. So we urge donors, funders to come on board, adopt the CAPSEA principles and action plans to further deepen engagement within the organizations and among their partners around best practices for dealing with issues of safeguarding within the organization. Our goal as an organization is also to work with funders, and through the CAPSEA, we have reached lots of organizations, both internationally and locally, to embrace this CAPSEA policies that enunciates this common approach. Is very simple, but if followed through, goes a long way to bring benefits to delivery of our programs, to beneficiaries on the ground, and to keep people very, very safe. Let me leave it at there, and as people come with questions, I'll be happy to answer them. Thank you very much, Dr. Eleanor.
Well, thank you so much, David, for, such an illuminating presentation, speaking to zero tolerance, telling us, about the 6 principles and the minimum actions, under CAPSEA. And, that speaking to us about the urgency of it. Safeguarding indeed is everyone's business. and that clarion call to fellow donors and funders to come on board with the CAPSIA principles. I would like to remind our esteemed participants, we do have the Q&A function. I'm sure you've got questions for David. Please do put your questions in the Q&A box. And now on to our second speaker, Diba Abunijila. Diba, tell us, please, what is the Nigeria PSEA Network's vision towards promoting the prevention of sexual exploitation, abuse, and harassment in the aid sector?
Thank you, Dr. Eleanor. I'm very happy to be here. Regarding your question, the PSA network in Nigeria plays a very important role in ensuring that both aid and development work in Nigeria is free from sexual exploitation and abuse. The zero tolerance slogan is our main slogan. And just to give an introduction, what is the PSA network in Nigeria? So the PSA network in Nigeria brings together various stakeholders, including United Nations agencies, non-government organizations, and also government actors and donors, with the shared goal of preventing sexual exploitation and abuse in the humanitarian sector, where all the vulnerabilities are exacerbated and we are dealing with different sets of emergencies, while the same also applies to development context. The network vision for promoting prevention of sexual exploitation and abuse in the aid sector is anchored on key principles and actions that prioritize safeguarding of the vulnerable populations, creating a culture of accountability, and ensuring that the organizations uphold to the ethical standards. So for the zero tolerance policy, which I will unpack one by one, it's as I mentioned before, it's the core of our slogan. It's the core of our work, because what we say always, there are no second chances. And to make sure that this is actually applied, we want also to make sure there is a protective environment where no instances, nothing is left to chance, and there are no excuses around the zero tolerance policy. So, for example, all humanitarian and development actors in Nigeria are expected to adopt all the measures to prevent, detect, and respond to the sexual exploitation abuse incidents. When it comes to, and to do so, we actually need to strengthen systems. So when it comes to strengthening systems, and I will highlight the word safeguarding, we need to strengthen our safeguarding policies and mechanism. So within our network in Nigeria, we always, and I will come in the presentation, how we actually develop the capacity. We always actually call for having very strong safeguarding mechanisms within the organization itself. As you have seen with my colleagues' presentation, the policies are there, the mechanisms are there, but what we are actually still facing issues with is the implementation. So it's supposed to be embedded in all the process of aid, and it's very easy to do, but it needs dedication and monitoring. So, for example, all the organizations should have clear code of conduct, and this clear code of conduct should be outlining the expected behaviors and standards for aid workers, and it should also be known for both the aid workers and the beneficiaries, so they understand what is expected from the aid workers. Also, we should have reporting mechanism, and for the reporting mechanism, we always say, if your organization is a small organization, if your organization doesn't have established reporting mechanism, you can always use the interagency reporting mechanism. And that's why the PSA network tries to highlight where are the strength key aspects and make sure that all the organizations in the process, they actually not left out. They actually can rely on each other. So, and when we highlight the reporting mechanisms, it's very important to have an accessible and safe reporting mechanism to the communities. So we can have the best reporting mechanism, but still they need to be safe and accessible to the communities, and that varies from one community to another. And the third one is accountability. So accountability should be highlighted and should be respected with both the aid workers and the communities. So uh, when there is an incident, it should be dealt in a and managed in an appropriate way, managed, and there is a survivor centered approach where it covers the whole investigation process. So there is very important that the population knows that there is nothing that goes without being sanctioned, and all not and there is no second excuse. It's a zero tolerance, and it's their right to report when they feel vulnerable or unsafe.
Wow. Thank you so much. Indeed, as they say, repetition is for emphasis. You emphasized for us, the zero tolerance. And, it was, quite strong to hear there are no second chances. And also, emphasizing also the importance of implementation. So, Deepa, yours is a network. Can you tell us a little more about the network's efforts towards supporting members who are part of this network in building their PSEA capacities to keep people safer in the course of their work as organizations, please?
Sure, thank you, Dr. Eleanor. As I always speak about the network, I speak as the network as a family. So where all the practitioners and the experts come together to make sure safer humanitarian uh, processes are there. So, for example, one of the good examples I can highlight is the monthly meetings where all the PSC network members meet. So we have different modalities of meeting, considering the size of Nigeria and with a focus on the humanitarian context. Sometimes we meet in line, sometimes we meet in a hybrid modality, but always there is a meeting where all our best practices are shared, our challenges are shared. What needs to be coordinated more is shared. So this kind of platform makes the members feel that they always can rely on the network for support, and of course for sharing, also to support each other. So our theme kind of we support each other. No one should be struggling alone. The second thing which I actually appreciate and cherish is when we have the safeguarding hub in the country, the safeguarding hub constitutes a great source of help. So, for example, when I came on board in Nigeria as the PSA coordinator, I was very happy to know that we have the safeguarding hub in Nigeria. And through the safeguarding hub, we had the assessment with the PSA network members on their needs of knowledge. And after the assessment, there were a series of webinars where we can actually address these knowledge gaps. So we already have two webinars with the Safeguarding Hub, and they will continue according to the findings of the assessment. And this one of the best examples how we coordinate also with other actors in the country who actually have also great resources and can be a great support for us. Beside the learning sessions, we also have capacity building workshops. So during this year, we already have training of trainers for about 17 just from my degree. And we will continue to have others to cover the Bay states in Adamawa and Yobe. And this is a very good example. I would highlight how it was important because after the TOT training conducted, they have actually to roll out the trainings to others and not just to their organizations. So you create a culture of cooperation where the trainer actually also get to know other organizations, what they do. They get to see what are the practices, what works, what doesn't work, and they share that knowledge. So it's not just to build capacity of the trainers, also to create this cooperative approach between all the members of the PSCA network. One of the good things that happened, like reflected the importance of that, was during the recent flood emergency, where we relied on all the trainers to actually make sure there is awareness raising messages to the communities. They actually trained the staff in the IDP camps. They also created awareness sessions with the communities, and they did that collaboratively. So we don't duplicate efforts. Everybody knows where are the gaps, and they rely on each other. Yes, I will cover this, I'll do this, and they coordinate with each other on the ground. And that's why it's very important to have this preparedness for emergencies. We would not be able to do so if we didn't have this team on the ground to just start training when there is an emergency. So that's why it's very important also to invest before and ensure that you have the resources, so when there is an emergency you actually can use these resources and make sure that in appropriate manner and in very quick manner.
Thank you so very much. Indeed, just highlighting for us, how the network is a family, and speaking to the wealth and assistance that comes from the Safeguarding Hub, with the needs assessment, tailored trainings, and a very, very recent incident with the flood, and being prepared. Before we open up for questions in the next 3 minutes, and I see a few questions already in the Q&A, Diba, can you just, tell us just a little more about the essential safeguarding procedures that network members are encouraged to have? Thank you.
Again, thank you, Dr. Eleanor. So for us in the network, there is actually, as I mentioned, there are a lot of guidelines when it comes to PSA. There are many structures, and to ensure the organization is well prepared, well covered when it comes to the internal procedures of its own policies and culture, we have kind of assessment. And this assessment is what can be found in the UN portal for partners. So the assessment in principle, it's similar to other assessments followed by international organization as well, because it looks at the key principles. And for that, we always, in the PSC network, we always encourage the members who did not go through any assessment, neither by the UN or the international NGOs, to do the assessment. And they can do that without being even a partner for the UN organization. Anybody, any organization, they can actually create their own profile using the UN portal for partners, and they just notify me and I can do the assessments for them. So this is one of the things where the PSA coordinator can support other organizations, especially the smaller organizations, to make sure they actually adhering to the certain rules and regulations, and to help them to build their capacity when it comes to internal policies, internal structures. So one of the things that I highlighted before is to have a clear code of conduct, to have a safeguarding policy. This is one of the things we check. Recruitment and vetting procedures. How do they recruit? How do they double check the people they are employing? And also, how do they do the background check? Do they have accessible self-reporting mechanism? Yeah. If they don't, they always can rely on the PSC network interagency mechanism. Do they have in their way of work SOPs, do they have referral pathways where it actually captures survivor-centered approach? If they don't have referral pathways as well, they can also use the the interagency referral pathways. So they're the community engagement. How do they engage with the communities? Do they have kind of this thing embedded with them? And also for investigation and accountability, how do you tackle that? So these are the core things that it's part of the check. And this is part of the how actually, if there are gaps, we work together to address the gaps. So the assessment is actually to improve, not to criticize. This is also what we always highlight, is that we work together to strengthen the system. Thank you.
Thank you so much. Working together to strengthen the system is a good segue for us to now address the questions that have been put from our esteemed participants today. We have heard from our two erudite speakers, and I'm now going to pivot to some of your questions. I do have a couple of questions asking about the sharing of the slides. Indeed, we will all get the slides from Mr. David's presentation for all of you that registered to attend this webinar. So that's to answer, the questions from Dorcas Elia as well as Rachel Tor. I will take us to Okechukwu Livingston Ikefuama is asking, says, please, I would like a recap of the CAPSIA principles. So David, can you give a quick recap, even though the presentations will go out with more detail, but a quick recap, please, of the CAPSIA principles.
Okay, thank you very much, Dr. Eleanor. So again, the CAPSIA is all around developing a common approach through which people can be protected from sexual exploitation, abuse, and harassment. And so the principle lists out 6 key things that we expect that organizations will put in place. One is to prohibit anything, have a zero tolerance to sexual exploitation, abuse, and harassment. Have it as something you prohibit within your policy, within your systems. Secondly, that zero tolerance to inaction. It's not just having a policy that says you have a zero tolerance, but also a policy around people not taking action when issues of SEER occur. So you must take action, you must attend to it, you must respond to it. And the other bit is around tailoring protection against SEER to the context that it's inclusive and is focused on the survivors, the victims first, their safety, their security, and their rehabilitation as quickly as possible. And then embedding SEER prevention as part of your working culture. So within your setup as an organization, embedding, streamlining policies around safeguarding against sexual exploitation and abuse and harassment to become part of your culture within the organization, so that everybody understands that this is not something we allow, that this is something that is prohibited, that inaction is also prohibited, and then the need to respond appropriately to suspicions of SEER happening and reports, and also being inclusive in terms of how you deal with SEER issues. And then lastly, respect for confidentiality to protect against retaliation. So the confidentiality of the survivor is also very, very paramount. You need to have that survivor-centered approach in terms of how you respond to SEER issues in your organization, such that the survivor is protected from retaliation or from further assault and harassment, and that every staff understand that this is our culture. Like we said earlier, safeguarding is everyone's responsibility. And so when from top management to the least staff, everybody understands that and also speaks up against SEER issues, then you go a long way to strengthening the organization, embedding these principles of CAPSIA, and then taking the minimum action steps as well. Thank you.
Thank you so much, David. And as I've said before, the details will be sent to you afterwards. I will be clustering the next set of questions for Diba from Fumilayo Hassan, Amy Oyekunle, who says, thanks, Diba. You said the network includes government, humanitarian, and development partners. How do organizations join this network? And the same question comes from Okechukwu Livingstone Ikefuama. For you, Diba, how can organizations join the PSEA network?
Hi, thank you for the question. It's very straightforward process to join the network. So I will keep my email address in the, I'll share it in the chat. And please just email me and I can actually send to you what are the requirements. We have the PSA network SOPs, which needs to be endorsed by the highest level at your organization. So it will be the executive board or the executive director. And with this, the SOBs, you commit to report to the PSCA network. And that's why we need that commitment to make sure that we share all the information needed and the network can actually function as it is supposed to function. That's why the commitment. Other than that, it's very easy to join. After that, we will be part of our monthly meetings. We will be part of our calls for participants in trainings. So you will have access to all our activities that we do. And also we have a library that is online library that you can access to resources. So it's just email me and I can actually introduce you to everything. Thank you.
Thank you, Diba. We do have another question that from Blessing Duru, who says, what are the best strategies that can help to empower community members to ensure SEER compliance? So this is referring now to community members. Would any of our speakers like to take that question, please?
Happy to give it a shot and make some contributions there. So for us, those communities are more like the beneficiaries of our development program interventions. And so part of our expectations from our program partners is that as part of their SEER policy and implementation, they help the local communities also understand the concept of the protection against sexual exploitation, abuse, and harassment. And as such, in helping them understand that policy and in helping them understand what SEER means, they too will not be taken advantage of by aid workers or development workers. And so within their own systems, I know various communities have various ways that they protect their people, vulnerable people, women, children, from harm. So it's more or less strengthening those systems that those local communities have through their intervention and helping to educate them on the CAPSEA, like I said, which is a very common, simple approach that every community can also adopt and internalize. And these are part of what we expect that our program implementing partners will also help their local communities, even their downstream partners, other CSOs, CBOs that work with our implementing partners to help the local communities understand and put in place to checkmate abuse arising from sexual exploitation, abuse, and harassment. Thank you.
Thank you, David. And hopefully that also answers Ahmed Nasidi and Bukar's question. We do have an anonymous attendee who has said, while we stress on safeguarding requirements from donors like FCDO, still when translated to the local partners somewhere, this only is followed up as a checklist/compliance. We still have leadership who raise their brows and indirectly yawn when safeguarding importance is mentioned. So how do we move from the concept of compliance on safeguarding, which often is seen as an obstacle more than empowerment, to instilling/welcoming safeguarding values from top to bottom in local organizations. And I think, we can take that with Kelechi Cynthia Iwoha's question that says, has the working group issued any checklists or guidelines to support safeguarding efforts during the program cycle, including assessments? So, who would like to answer that question? Any of our panelists? Those two questions that, refer to compliance. Mm-hmm.
Well, again, I'd like to come in here, but happy for Diba as well to chip in. Firstly, for us, in terms of the compliance, and that's why we go through the thorough due diligence assessment process for all our implementing partners. And we expect also that our implementing partners will cascade that down to their own downstream partners in terms of going through the whole hog of the due diligence assessment, not just as a checklist, but also looking at that. So for us in FCDO, after the initial due diligence assessment, before we contract you to implement any program, in the course of your delivery, with every interface we have with you, the program managers will also check the status of your SEER compliance within your setup and your systems. In the broader outlook on the initial question, I think it highlights the need for us to work together as a unified whole to drive the message of protection against sexual exploitation, abuse, and harassment of beneficiaries, and not just beneficiaries within your organization, with your implementing partners, and with also the beneficiaries. But the government itself has a huge role to play in this regard. We have pushed sometime in the past to try and get the government of the country into that space to understand the importance of protecting people from sexual exploitation, abuse, and harassment. Many of this we have done through our work in Lagos with the Mirabel Center that also helped develop safe houses, but also working with the police systems to create specific desk officers that understand the importance of SEER. And as such, when victims come, they can be properly attended to and their issues and challenges addressed. I think maybe Dr. Eleanor will help me here if I didn't get it quite right. But even at the assembly point, we are trying to push that a bill is passed on sexual assault register, where perpetrators are reported and can be put into that register that is open and available for people to easily access, and also continue to report these incidents. But pressures on government is not something that just FCD as an international player can do, but it takes all involved in this space, in this sector, to work together to push that to the fore of the leadership of the day in the country, such that such laws are passed, and not just only passed, but also implemented and with appropriate funding. Thank you.
Yeah. Thank you so much. And we do have quite a few questions regarding, can we have social media? Can we have safeguarding data? And I will ask very kindly that the links to the resource and support hub are put in the chat at this time. Thank you again, David, for, stressing that, we move from the checklist to just compliance onto making it a culture. There's a question from Kelechi Cynthia Iwoha. Probably, Deba, you can take this. It says, I would also like to know how FCDO and PSEAH team promote inclusivity. Persons living with disabilities and other diverse, vulnerable, or marginalized groups in their safeguarding efforts. Deba, are you able to take that, please?
Yes, thank you for the questions. It's very important. So when it comes to people with disabilities, That's why we always stress, as I mentioned, safe and accessible reporting mechanism. And when we say accessible, it's not just accessible to the general population, it should be accessible in all. So it should be accessible to people with disabilities. It should be accessible to everybody who is part of the humanitarian assistance. The other thing is uh, the people with disability inclusion is already embedded, so in any part of our interventions. So
Thank
it's not
you.
just a check. It's something that we focus on, that this is for everybody. So for
Thank
example,
you
when we
so
do
much.
materials,
Yeah.
for when we do
I'm
mat
afraid, Diba,
yes.
so sorry.
Uh,
We are really pressed for time now. And I know you were in mid-sentence there, but really that's all we have time for today, sadly. So thanks again to our panelists for their informative and illuminating presentations. You will see a poll come up, um, which we would request you very kindly to complete. What it does is it'll help us to tailor our services to suit you and continue to improve on the events that we deliver. As said before, we will be sharing this webinar recording and slides to you shortly, as well as any other related resources. Um, if you want to hear about future RSH webinars, please subscribe to our newsletter. The link is there also in the chat. We do want all of you on the call to please participate in the webinar hub poll that is going on now. We cannot thank our presenters enough. Now, some of the questions that we didn't get to will definitely be answered, and the answers sent to you via email since you registered. So we tried our best to cover all the questions, but we do realize that there may have been some aspects that we didn't quite get to on account of the limited time. So we are giving the remaining 2 to 3 minutes now and asking you most kindly to complete the poll. So far, we only have a third of the attendees who have completed the poll, and we would really like to urge you to complete the poll that is right now on your screens. As I've said before, it helps us to better tailor our services to suit our attendees and participants. And we really want to continue to improve on the events that we deliver. You will be getting the presentations. Again, I'll emphasize that everybody will get the presentations that have been made today. Please do see the link of that we have put in the chat regarding where you can get resources on safeguarding. And it is left for me to thank again our erudite presenters and to thank you, our esteemed participants, for being such an engaged audience today. Thank you for your questions, and we will be addressing any questions that we didn't get to. Bye for now, and thank you.
Thank you, Dr. Eleanor. Bye all.
Thank you, Dr. Eleanor. Well, bye all.
Thank you.